Hello friends, good morning. So today I will demonstrate the EMI spine surgery. Before that I will introduce the different instruments required for doing the EMI surgery. So there are the open arms, also there are the closed arms. You can use these arms to make the normal screw into the long arm screw. Okay. This is the poly screw. This is the nut. This is the rod. This is the rod caliper for measuring the length of the rod. This is the rod inserter mechanism. You can use this mechanism for insert the rod. This is the K wire, and this is the block. This is the tower. Okay, so how to make the assembly of the screw with the this extension mechanism? So insert this screw here, put the tower, and then insert this long arm extension, and then you can use this one for tightening this poly screw with this extension bar or mechanism. Now it is tightly attached this poly screw with the long arm extension bar or mechanism. Now it's become a long arm screw. Now the first step in the MIS spine surgery is to make the incision with the special tool called as Havel tools with the trosser mechanism. Right now I don't have the trosser mechanism, but what I can show you, it is the Havel mechanism or Havel tool. You can use the handles, you can do the assembly of this handle, and then depending on the the X-ray and the situation of the vertebra, you can do the incision in the vertebra of the body. Once the incision is completed, then you can remove this tool. You can remove this handle, not tool. The tool will remain there. Remove this handle, and then you can use this K wire and fix the K wire inside the vertebra of the body, and then you can remove the incision tool or the Havel tools. Okay. Now this wire will remain inside the vertebra of the body until we fix the poly screw, rod, and some other components. So I will show you this. So this will go here, and then the next stage is to make the the tapping. We have to tap this hole. So we will use the tapping this tool or tapping tool with the handles. Okay, so we can do the tapping operation until the length of the poly screwdriver, and then once it is completed, we can remove this handle and we can remove this tapping tool. Then we can fix the dilator A and dilator B. This is the dilator A. This is the dilator B. So you can insert the dilator A here. Okay, and then insert the dilator here. So this dilator will be mounted on the vertebra of the body through this wire. Now the next the stage is make the assembly of the poly screw with the poly screwdriver. So we will already make this long arm screw. So we can use this poly screwdriver. You can use the handle whatever you want. Some people they like the T handles. Some people they like the round handle. So depending on your choice, you can choose the handle and then tight the poly screw with this poly screwdriver. Okay. Okay. So now it's become a tight assembly. So now this poly screw is ready to insert inside the vertebra of the body through this. Before that, when we insert the poly screw inside the vertebra of the body, we will remove this dilator A and dilator B, and then we insert the poly screwdriver through the K wire. K wire always remain there inside the vertebra of the body. So this we insert the poly screwdriver like this, and then you do the screwing operation inside the vertebra of the body until we fix the poly screwdriver. Okay, and then once it is fixed, then you can unscrew the poly screwdriver so that we can remove it. Okay, we can remove the poly screwdriver. Now the screw is inside the vertebra of this body. Now we will use the this rod insertion mechanism. These are the rods. Before that, we will measure the length of the rod. So this is the caliper to measure the length of the rod. So we insert this caliper into the extension box, two extension box for first stage surgery. Three, we take the this is the first stage surgery for we use the only two screw. So we can insert here. Okay, and we can you can insert this caliper until it touches the head of the poly screw inside the vertebra. So after that you can remove this and you can just measure this with the help of your scale. You can measure the length. Now once you measure the length and once you choose the the length of the rod, even you can do the rod bending if you want. Sometimes it needed, sometimes it doesn't need. So this is the rod bender for bending the rod. Now I will show you how to use the the rod assembly mechanism. So this is the rod assembly mechanism. Just we have to screw this knob and the rod will be fixed. Now this rod is ready to go inside this. Okay. Before that, we insert the rod, we remove now the K wire, and then the rod will go here. Once it is placed, then we can release the rod with the help of this knob. We can unscrew it and we can release that rod on top of the poly screw. So the rod will remain here. So once the rod is placed here, then the next operation is the placement of the bolt or cap. Some people they call it as a bolt, some people they call it as a cap. Now we use the cap driving mechanism or cap driving tool. This is a cap driving tool. We can use the handle whatever you want. I use the round handle. Okay, and then you can use this and fix the cap on the top of the rod. Okay, now the rod is the cap is placed on the top of the rod. Okay, now the final tightening operations is to be done with this anti-torque handle. So you can keep this here, and then you can use the final tightening instruments. So this is the final tightening instruments. You can use the handle, this handle, and then you can do the final tightening. So the final tightening is done like this. Hold this tool and then do the apply the torque. So until you apply the full torque, the cap will be placed very properly and tightly. So this is how the final stage, the final tightening will happen. So then remove this tool, remove this, and finally we have to remove this long extension mechanism. So use this tool to remove this. Okay, and now only the poly screw, rod and the cap or bolt will remain inside the vertebra of the body. So this is how the MIS surgery procedure will take place. So next time I will show you this MIS surgery procedure with the actual model of the vertebra. I hope you understand how to do the MIS surgery and how to use the instruments, the MIS instrument. The basic purpose of this video is to show the demonstration of this video. Okay, so next time I will show the actual surgery with the the actual model of the human vertebra. Okay, thank you.